I never went into medicine thinking that I potentially could change how we care for patients. The surgical home has been the perfect vehicle to show that anesthesia as a specialty really cares for the patient from the decision to have surgery to post-discharge and can be a part and a big factor in making the success of that for the patients. We're a value to the hospital. We've built our relationships with our surgeons, and the patients are really doing better with what we do, and we actually see that every single day. Hi, my name is Rob Shakar. I'm the medical director for NAPA at Novant Health and Hanover Regional Medical Center in Wilmington, North Carolina. We were one of the first groups to join that collaborative within our national society to form and be the innovators in a streamlined episodic-based care model that put the patient at the center of the model in order to improve outcomes, standardize how we take care of patients, and ultimately lead to a savings across the healthcare markets. Patients wanted to be involved in their care, and we just made it too complicated, too complex with educating them, too complex with setting the expectations as to how their care is going to flow. And through this model, we have streamlined that and made it more simple.
A patient who is considering surgery will start in a surgeon's office, and the time that the decision for pursuing surgery occurs is really when the clock starts for that patient and getting them prepared and optimized for surgery. So we call that window of time between surgical case posting and day of surgery the optimization window. And the more time we have, the better prepared a patient can be for their procedure.
We make sure that they're ready for surgery, not just that they can get through surgery, but they're at their peak physical performance, that their comorbidities are all optimized. We'll even do home visits in order to determine, are there areas where they have steps or things of that nature where they could fall. So it's really a total evaluation of not just the procedure and getting them ready for the procedure, but it's looking at their social status and do they need help with things at home, making sure that they don't have any unintended issues following the surgery that causes them to come back or do anything of that nature.
Knowing that when we're preparing our patients for surgery and getting them ready, we feel really comfortable that they're getting taken care of and getting all the care they need before surgery. Patients are happier. I think obviously the communication between the surgeons and the anesthesiologists and the team really has been great, and I think just a better camaraderie amongst the whole OR staff.
We had a range of surgeon outcomes where one was in the top 10% in the country in their outcomes and then others were not. And so we showed them that we could, by standardizing the approach and emulating what our highest performing surgeon was doing, we could bring the others up, which we did after 1 year's time. We decreased complications by 33%. We decreased readmissions by 1/2. We decreased length of stay by 1/2. And so we have a large patient volume for our total joints. We do over 2,500 joints a year. And so when you equate that in the first year of orthopedic surgical home, we saved $4.2 million. One of the most important things that we did was we created a nurse navigator position. So we have a nurse through our surgical home that is over each service line, that is in contact with the patient. She's the one who does the education for the patients up front. She's the one who makes that point of contact. And so when patients started to have problems at home for whatever reason, because many things can happen, they would call her directly. And she would be able to navigate whether they needed to go to the surgeon, whether they needed to go to the hospital, and how can we avoid them coming back for a readmission of that nature. And so that point of contact was really the successful piece of this.
It's not just the surgeon, not just the anesthesiologist, but it's the entire team. It's surgeon, anesthesia, nursing, CRNA leadership, our inpatient, our outpatient teams, really having case management at the table, everyone working together trying to prepare that patient for post-discharge. Our quality has improved as well as our patient experience. We're all partners together and for the care of this patient. So it brought everyone to the table. It allowed data to be driven for decision making. It allowed us to really look at, well, what does the best look like and how do we drive towards that?
I think everybody knows surgery is a team sport, and sometimes anesthesia is in the background of that. And this has really put them at the forefront for us. Surgeons now understand how big a role that anesthesia plays.
So we started scaling the process after our initial success with orthopedics. And now we've grown it to 16 different service lines. In 1 year, we were able to save $12 million over different service lines, and the hospital was very happy, and the surgeons were happy as well. To me, the exciting piece of this is there is a pervasive feeling out there that healthcare is very expensive. And so what we were able to do in a community hospital, I believe could easily be implemented across all of healthcare. And if just a fraction of the savings that we had could be done at every single hospital, to me, that really bends the cost curve for healthcare. You can really ultimately save money, and we can make healthcare a lot less expensive than it is. And not just looking at dollars, but you're looking at the outcomes, because patients are doing better. Patients are a part of their care. Ultimately, it's how can we have the patients have the best outcomes so that they can recover and get back to their daily living.